Are we gonna put like cool 80s music while I make it? It's like do 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 do, and like as a circus music. Da, 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 da.
If Apple has free 80s and circus music, if they have free 80s circus music, I will use that for sure.
Hi, my name is Ankit Gohel. I'm a EM pharmacist at Maimonides Medical Center. I did my PGY2 in emergency medicine pharmacy here about 4 years ago, and I specialize in resuscitative care.
Ankit, can you tell me from a pharmacology perspective why push-dose pressors even make sense?
Sure. So when we look at any drugs that are continuous infusions, they typically have to build up to a level in the body known as steady state. Now, kinetically, steady state is defined as the amount of drug coming into the body is equal to the amount of drug being metabolized and eliminated from the body. Now, most drugs typically take about 5 half-lives to reach this steady state. And so for all of our pressors, they typically have half-life somewhere in the range of 1.5 minutes to 2 minutes. So it may take up to about 10 minutes to see the full effect of a pressor. And if you have a crashing patient, 10 minutes can make or break outcomes. And so the idea of a push dose pressor is to give a patient steady state like concentrations. We can mimic the concentration of drug in the body to look as if it's like steady state until our continuous infusion can kick in.
Okay, you want to show me how to make some of them?
Sure. Let's get it going. No, please cut that out. No. Don't, Duncan, please. No. This particular epinephrine is the 1 in 10 ml. So this is the code dose epi, or the 0.1 milligram per ml. Start off by opening the box. And you'll get these 2 ampules right here. It's called a Bristajet. You attach the Bristajet on, and we're trying to make 0.01 milligrams per ml. So we have to do a 10 times dilution on it. So what you do is you take 1 ml of code dose epi, inject it into a 10 cc syringe, and 9 cc's of sodium chloride. All right, and there's your push dose epi. So each ml is 10 micrograms. So the typical dosing is anywhere from 0.5 ml to 2 mLs per dose. We're essentially giving a bolus of this drug to give the patient a steady state like concentration until the epinephrine drip kicks in. Typically, these push doses wash away within their 3 to 4 half-lives. And so you might have to redose again in about 6 to 8 minutes. So it's important to not give push doses and walk away from the bedside. There are 2 different ways that we can make this. So depending on your institution, you can purchase a pre-made norepinephrine bag, which could vary from 8 milligrams and 250 or 4 milligrams and 250. So just double check your institution to see what concentration you carry. This particular bag is 32 micrograms per ml, which is pretty concentrated. If you have a crashing patient and they need some pressor, we can draw out 1 ml knowing that there's 32 micrograms in here. And we can give small aliquots of 0.5 cc, which will be 16 micrograms, which is within the range of where we want to dose our patient, anywhere from 5 to 20 micrograms at a time. You might not have these pre-made bags, and so you might carry these much more concentrated vials, which is 4 milligrams and 4 mLs, or 1 milligram per ml. So you crack the ampule, you withdraw 1 ml of norepinephrine using a filter needle, because we don't want to inject our patients with glass. Change out your needle and inject 1 ml, which is 1 milligram of norepinephrine, into 100 cc's. Now we have a concentration of 10 micrograms per ml within this bag. So the concentration of this is 10 micrograms per ml. And the typical dosing that we would give to a patient is anywhere from half an ml to 2 mLs, or 5 micrograms to 20 micrograms at a time. So this is a commercially available product that we purchased. So we thankfully don't have to prepare push dose phenylephrines. There is a concentrated phenylephrine used to make phenylephrine infusions. Now, if you notice the concentration, it's 100 milligrams and 10 mLs. So we're talking about 100 times the concentration in here than what is in the stick. So I do heed some caution with using this because 100 times dosing errors have occurred before. There are many reports of it with this particular product. In order to prepare a push dose phenylephrine, you take 1 milliliter of this concentrated product into a 100 cc bag. So I'm putting 10 milligrams inside of 100 cc's. So the concentration then becomes 100 micrograms per ml, which is the same concentration as this phenylephrine stick. Now you can draw out of this bag and have the same concentration of phenylephrine in here as you do in this push dose phenylephrine. The push dose phenylephrine is 100 micrograms per ml, which is a little different from our other push doses, which are typically 10 micrograms per ml. Typical dose is anywhere from a half an ml to 2 mLs, which is 50 to 200 micrograms.
If you were a crashing patient and I was gonna drop some push dose Pressors for you, what would you want me to give you?
So I would prefer push dose phenylephrine just because of the sheer convenience of it. It's ready made in a lot of places. It's quick to get. It doesn't involve complex mental math. I would ideally want push dose levofed in a perfect world. I think it's a superior pressor to phenylephrine in certain disease states, but in our imperfect world, push dose phenylephrine is probably your pressor of choice.
And all right, thank you, Trisha.
Thank you, Duncan.
Bye. You guys have a good shift, okay?
All right, see you later, Duncan.
Bye.
Wait, let me show you what Trisha had to go through for this. She's like on a chair, and it was a balancing act. Trisha's the real MVP.
Real MVP.
Thank you, Trish. None of this would be possible without you.